Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of NAAOP. Well, we've selected a George and Dena Breece Fellow for 2024, and her name is Taylor Haines. Congratulations, Taylor. We're very excited to have you join us this summer, around May 20th through July 26th, for the fellowship that will feature an education about O&P policy and advocacy. Taylor was selected through a search committee after a competitive process that saw just some exceptional candidates. We only wish we could have more fellows and not have to tell the people that we did that unfortunately they were not selected. We will be working with those people to try to ensure that they become involved in NAAOP and get to know O&P advocacy, but in different ways. Taylor was born and raised in Alaska and now is in Portland, Oregon. So she'll be traveling across the country to spend the summer in Washington, D.C., located in the NAAOP's new offices at 1250 Connecticut Avenue. Taylor is a below-the-knee amputee since early in her life, and ultimately has used a prosthesis ever since. She currently is a clinical or patient care coordinator with the Hanger organization in Portland, Oregon. So we expect that she will have a long career in advocacy and policy, and that will add to her already significant accomplishments in the O&P field. So Taylor, we welcome you. We will ask you to deliver one of these videos to our membership in the future, and we're really excited about you starting with us this summer. Let me move on to another big announcement, and that is the introduction of the Senate legislation, the House companion bill to the Medicare Orthotics and Prosthetics Patient-Centered Care Act. The bill was introduced last week. The policy forum is next week, and a number of people will be flying in to Washington to hit Capitol Hill and try to get as many co-sponsors as we can. The bill is almost identical, but there's a couple of differences, but mainly it's a companion bill to the House legislation. The Senate bill number is S-1377. It was introduced by 2 Democrats and 2 Republicans. Senator Warner from Virginia and Senator Klobuchar from Minnesota are the Democrats, and the Republicans are Senator Haines from Montana and Senator Cornyn from Texas. So good representative individuals, very strong on the Finance Committee, which is the committee of jurisdiction for this legislation. We look to try to build co-sponsors over the next weeks and months and add to the support that this bill has already in the House and try to move this bill as expeditiously as we can. And finally, we just held a webinar on Medicare Advantage tools to challenge denials of orthotic and prosthetic care. It was well attended. This may sound like deja vu. We held a similar webinar last July, but felt as though our membership and others in the field may not have really grasped and had been as aware as we wanted them to be about the new MA rules that can really make a difference in making sure that your patients and your businesses have a better access to Medicare orthotic and prosthetic benefits for those that take advantage of the managed care program under Medicare known as Medicare Advantage. So we do appreciate the 80+ people that participated in that webinar, and we're looking forward to any questions that might arise as a result. Please consult the NAAOP website at naaop.org if you have any questions about that. If you'd like to join NAAOP, if you'd like to support the fellowship, thanks so very much.